Ladies and gentlemen, uh, we will begin momentarily. I'm asking everyone to kindly make their way to their seats. Anyone outside of the tent, please come and have a seat. We begin shortly. Morning again, ladies and gentlemen. Thank you so much for your patience. We are about to begin. At this point, I'm going to kindly ask that we all stand for the singing of the national anthem.
Good morning.
Guard us with thy mighty hand. Keep us free from evil.
Strengthen us, the weak to cherish. Give us vision, lest we perish. Knowledge send us, Heavenly Father. Grant true wisdom from above. Justice, truth be ours forever. Jamaica land we love. Jamaica, Jamaica, Jamaica land we love.
You may be seated. Thank you very much, Mr. White, for leading us in that anthem. Ladies and gentlemen, welcome again to the groundbreaking and signing of contract ceremony for the Greater Portmore Comprehensive Health Center. My name is Dr. Joseph Kelly, and I am the medical officer in charge of this institution. And it is a privilege to be here, and it's a privilege to see so many people here to represent on such a momentous occasion. This work is being done through a collaboration with the Ministry of Health, the Health System Strengthening Program, and grant funding through the European Union. And it's a vital part for the community, and it is something we all can agree is well needed. At this point, I'm going to invite Mrs. Tricia Hughes-Reed, a community health aide of the Greater Portmore Health Center, to come forward and lead us in prayer.
Good morning, everyone. Shall we all stand for prayer? Let us pray. Guide us home, thou great Jehovah, pilgrim through this barren land. We are weak, but thou art mighty. Hold us with thy powerful hand. Eternal God, our Heavenly Father, we worship you this morning. We magnify you, we exalt you, we honor you, because indeed you're a good God and you're worthy to be praised. We want to thank you, God, that when you put us to bed last night, you wake us up this morning, clothed in our rightful mind. It's a privilege to be in our rightful mind. It's a privilege to be alive. And so we give you all the glory, honor, all the praise. You said in Psalms 127, verse 1, except the Lord build a house, they labor in vain that build it. Except the Lord build a city, the watchman waketh but in vain. So this morning, as we come for this groundbreaking and signing, I pray, oh God, that you will take full control. And as the building starts, I pray, oh God, that you will be the chief builder and that all into your divine will. I ask as this program begin today, that everything will be done decently and in order. And at the end of life, oh God, we may say it was good for us to do what you call us to do. We are thanking you this morning for loving us in spite of us and for never treating us as our sin deserved, because none of us would have been here. We magnify, we exalt your name, and we give you thanks. In Jesus' name I pray. Amen.
You may be seated. Thank you very much, Mrs. Reed. At this time, I'm going to invite Mr. Abdon Campbell, our parish manager for St. Catherine Health Services, to give us the official welcome.
Thank you very much, Dr. Kelly. Good morning, all. Good morning. Welcome to the Sunshine City of Portmore. And you know, those of us who know Portmore for a long time, Portmore was referred to as across the waters, because a lot of the residents used to come from Kingston into Portmore. Now, Portmore has just over 170,000 citizens and still growing. So, today is really a special day in the life of Portmore. Welcome all. But there are some persons that you will forgive me that I will have to specially welcome. But before I do that, let me give a little caveat. You know, I'm a Kiwanian. And in the Kiwani circle, if you go to the podium and make a mistake, you will be charged. I may make a mistake with pronouncing some names today. Please don't charge me. Welcome to the Honorable Dr. Christopher Tufton, Minister of Health and Wellness. Welcome, sir. Welcome to Pastor Susan Rowe Bligin, JP, representing Costas Ratellorum of St. Catherine. Welcome to the Mayor of Portmore, His Worship, Mayor Leon Thomas. I'm looking around, but I have not, but even in his absence, we are in his area, and therefore we have to give due respect and give him the welcome that he deserves. Her Excellency, Dr. Eja Ascola, Head of European Union Delegation to Jamaica, Brazil, and the Bahamas. Ms. Natasha Marthoff, Inter-American Development Bank Country Representative. His Excellency Elaine de Grest, Embassy of Belgium. His Excellency Oliver, and this is where we have a big problem now. His Excellency Oliver Guéant-Vache, Ambassador from the Embassy of France. Mr. Javier San Roman, Chief d'Affaires of the Embassy of Spain. Mr. Fitzjackson, Member of Parliament, St. Catherine Southern. Mr. Robert Miller, Member of Parliament, St. Catherine, Southeast St. Catherine. And it's good to see both of you sitting side by side, sir. You know, a lot of persons don't know that parliamentarians are good friends. And you just put it a little bit further. Thank you. Representative from the Ministry of Health and Wellness. It's difficult to call all the members here because they are out in their numbers. Welcome. Senior Nurse Thomas Yetman, representing the Office of the Chief Nurse. Other representative of the ID Bank, Chevelle Hibbert, Operation Analysis, Lorenzo Esconda, Chief of Operation, IDB, Tamika Parchment, Communication Consultant, IDB. From the EU, Brittany Hutchinson, Castel Nunes. Representative from the company China Harbor Engineering Consultant Company, J. Wang, General Manager. Gary Scott, Special Consultant, and Andreen Jones, Health and Safety Officer, Matthew Jones, Environmental and Safety Officer. Welcome to the Regional Director of FARA, Acting, Mr. Lascelles Brown, Senior Medical Officer of Health for St. Catherine, Dr. Prosper Francia Chen. Welcome. Welcome also to the CEO of Spanish Town Hospital, Ms. Jacqueline Ellis. Members of staff of the Greater Portmore Health Center, St. Catherine Health Department, and the wider St. Catherine Health Services. welcome all to the Sunshine City of Portmore. Welcome to this contract signing and groundbreaking ceremony for what will be the comprehensive health center of Greater Portmore. Again, welcome all.
Thank you very much, Mr. Campbell, for that warm welcome. I must apologize for His Worship, Mayor Leon Thomas. I'm told that there's a parish council meeting that's taking place right now, and we know that national meetings takes precedence as well. However, I also want to apologize for Honorable Iselin Golden Custos, but she fortunately sent someone on her behalf, and I'm going to invite that person right now to give greetings, which is Pastor Susan Rowe Bligen.
A very pleasant morning. Dr. the Honorable Christopher Tufton, Minister of Health and Wellness, Her Excellency Dr. Erja Ascola, European Union Ambassador of Jamaica, Natasha Mark Zoff, Country Representative in Jamaica, Inter-American Development Bank, Fitz Jackson MP, Member of Parliament, St. Catherine Southern, His Worship, the Mayor, oh, he's absent, right? Abdon Campbell, Tricia Hughes, Dr. Joseph Kelly, all other distinguished ambassadors, a very, very pleasant morning and welcome. Indeed, it is an honor to represent the Honorable Custos Rotulorum of St. Catherine, Iselin Golden, at this significant occasion. And you heard it, the groundbreaking and contract signing ceremony for the expansion and renovation of the Greater Portmore Comprehensive Health Center. This facility will be a wow factor. It will be an upgrade to a Type 5 comprehensive center, which marks a transformative step for healthcare delivery within the Greater Portmore community. With impressive dedicated spaces for critical services such as X-ray, oral rehydration, laboratory, asthma treatment, physiotherapy, the people of Greater Portmore will have access to enhanced medical care right at their doorstep. Let us give a round of applause for that. Yes, distinguished guests, I was told that the new building will not only provide modern infrastructure, but also a more comfortable and supportive environment for our patients and healthcare workers alike. This project, I can assure you without a shadow of a doubt, will directly benefit the sick, the vulnerable, ensuring they receive timely, high-quality care and reducing the need for travel long distance for specialized services. Another clap, please. I must commend the Ministry of Health and its partners for their vision and dedication to improving healthcare infrastructure across the island. Your solid commitment, sirs, to the health and well-being of our citizens is truly commendable and deeply appreciated. This initiative represents hope. It represents progress for the people, the community of Greater Portmore, which I am a part of, and serve as a testimony to what can be achieved through collaboration and dedication. Thank you so very much.
Thank you so much, Pastor Rowe. We have representation from Portmore nonetheless, and at this time I'm going to invite Member of Parliament Mr. Fitz Jackson to bring greetings on his behalf.
Thank you, Mr. Master of Ceremony, Minister Tufton, other members of the Ministry of Health team, Councillor Van Rick Preddy, not representing the mayor, but in his own right here as the counselor for this division that the health center falls. My colleague MP, I won't say Big Rob, Robert Miller. Sorry. You see, Mr. Master of Ceremony, you were curious why he was sitting beside me. But this gentleman grew up in my hand as a student at Bridgeport High. Just that he has lost his way somewhere along the journey. But I don't give up on him. I have hope that he will be rescued. So I have to keep him close to me. Our Madam Pastor Rowe, representing the Custos. Your Custos here today. One day Bakra. Right? So you are our Custos for this function. Members of the external team, we have the IDB, Natasha Marzov, Her Excellency Dr. Ashkola, other members of your team, and I think the contractors are here. I heard a name mentioned and I checked with Minister Tufton and I believe there was a little crossing of the details. But I gather the contractors are here, with whom I want to have a discussion before we part company today. Ladies and gentlemen all, I welcome you to this function, and I must say I am a happier member of Parliament now than I was before, because we have gotten to this point. Long in coming, quite long in coming. There's a long gestation period between concept and being at this stage. And why I mentioned that I want to have a word with the contractors before I leave, because we don't want the construction period to have a longer gestation as the concept to where we are now. But no doubt you will be working diligently to avoid any undue delay. This expansion project is most welcome to satisfy the growing health needs and demands, not just of Greater Portmore, but the entire Portmore community. What we have here now represents the end result of continuing expansions over the years, from what it was, Minister, when it was originally built, to what it has now. A number of additional facilities have been provided since. It was never intended to be the end then, in terms of its offering. But in order to meet the increase in demand, much have happened and much more need to be done, which give rise to what is about to happen. When I heard Pastor Rowe mentioning about the scope of what will be offered, I remember I was once a regional health management board member of Spanish Town region years ago before my present dispensation. And one of the things I learned, Minister Tufton, that you know, no doubt have realized as minister, once you develop the facilities in one area to a very high level, you get a crowding in from persons coming from other areas. I remember when we did some expansion at Spanish Town Hospital, the new maternity ward there, and we had people coming all the way from St. Mary way and coming to that facility because of how comparably advantageous it was. No doubt, Minister, we're going to have this here from the design and the scope of work that this project entails. The residents of Portmore, and I'm deliberate to say Portmore and not Greater Portmore, will be most welcoming of this facility. I can give you the assurance that between Councillor Preddy and myself, we will work very closely, as we have been doing with the facility here, to ensure that the standards are maintained, and not only standards in terms of physical facility, but with the Ministry of Health to ensure that service standards are maintained. Because the truth of the matter, Minister, when persons are ill, any one of us, that's our most vulnerable period in our lives individually. And when I think about health service, I think about myself, what I would want personally, and by extension, what each resident, each Jamaican that enter a facility, what they would expect and what they should get, or I dare to say what they ought to get. So service is important. Not just the physical provision of the service, but even the manner in which the service is provided to persons who enter the building here. Ladies and gentlemen, I'm repeating a mantra that I have adopted from Miss Barbara Gludon of blessed memory, I heard years ago. And I will keep on repeating it, because to use your term, Minister, it must sink in. You remember that? We may not become a wealthy country, but we can become a quality country by how we treat and relate to each other. May not be wealthy, but we can become a quality country. And the quality is how we treat each other, which doesn't require a dime. It just requires a certain attitude and a certain mindset. So I look forward to this facility. And on behalf of the residents of my constituency, Robert's constituency, and Mr. Terrelong constituency, want to say thanks to be having arrived at this point. Thank you, ladies and gentlemen.
Thank you very much, Mr. Jackson. Two things that definitely stood out to me. Yes, service is important. Not only physically, but the manner in which we serve. That is essential. And I definitely think, and I'm sure all my colleagues will agree, this construction is well needed. There's a running joke at Greater Portmore Health Center that we need to get something for the ambulance team, because since August till now, we're calling the ambulance average 3 times per week. One day we call the ambulance 4 times in one day. So it is crucial that we have the right tools and capabilities to serve the people as best as possible. Also, Mr. Jackson, thank you so much for you and your team, always ready to step up and help. What's clear is that you keep those who are close to you under watchful eye, as evidenced by your relation with Mr. Miller. So we know that we be kept under watchful eye throughout this construction period. If I can suggest a gestation period for the construction, I will go with 9 months. All right. So, you know the HSSP loves to get the community involved. And what better way than to have children involved? And as such, we extended an invite to Greater Portmore High School for the kids to come and do an item. However, due to conflict of schedule, it's exam period. And we don't want to disrupt that schedule, but they sent us such a great and reliable substitute to do a great job. So at this time, I'm going to invite Mr. J. Hugh White, who is the music teacher at Greater Portmore High School.
Good morning again, everyone. Before I sing this song, the name of the song is Limp. I know it's not because we're at the health center, although some of the lyrics may speak towards some injury and being feeling sick or whatever. It's really about feeling heavy burdened. And the Bible says, or God says, to cast your cares on Him. So if you listen to the words of the song, you will understand what I am saying. Hey now. innocence stolen, and I know I'm a different man. See, life hits and life hurts. Think I've seen some of life's worst, but you've been here, so you understand. See, I fell and I broke something, but I couldn't tell, 'cause I kept running away from your love and grace. So my trips and my pains, my failures, they only make me desperate to seek your face. The devil hoped this injury would make me stop and take defeat, but I know Jesus walks with me, so I just keep on walking with my limp on. 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 I'm imperfect, so I slipped up and I had my heart ripped up, but you're the lifter of my head. So please come and please heal how I think and how I feel, and I live by what you said. And he says, heavy laden, come to me, the sick, the flawed, the lame, the weak, and I'll be everything you need. I'll just keep on walking with my limp on. Just keep on walking with my limp on. Just keep on walking with my limp on. Keep on walking with my limp on. Hey, limps are every weakness. Limps are every flaw that keeps us from having an otherwise perfect walk. We were born handicapped, but God gives us strength back, and all that you lack if you just keep on walking with your I pursue you, my victory, 'cause when they beat you, you look just like me. You were struggling with your passion and your love kept you walking with your lips. Calvary walking with your lips. No matter what we say, you kept walking with your lips. Yeah, that's my Savior with his lips. Just so one day I could walk with my limp on, and I could still be used even with my limp on, and I could still be loved even with my limp, and I could still be saved even with my limp. Oh, so I just keep on walking with my limp. Thank you.
Thank you very much, Mr. White, for that rendition. At this time, I'm going to invite Mr. Orrit Clark, who is the program manager for the HSSP, to tell us what exactly we can look forward to for the Greater Portmore Comprehensive Health Center.
Thank you, Dr. Kelly. Dr. the Honorable Christopher Tufton, Minister of Health and Wellness and Member of Parliament for St. Catherine West Central. Mr. Fitz Jackson, Member of Parliament of St. Catherine Southern. Mr. Robert Miller, Member of Parliament of Southeast St. Catherine. Her Excellency, Dr. Ira Ascola, Head of the European Union Delegation of Jamaica, Belize, and the Bahamas. Her Excellency Ellen de Gies, Ambassador, Embassy of Belgium. His Excellency Olivier Guillaume Varch, Ambassador for the Embassy of France. Mr. Javier San Roman, Chair the Affairs of the Embassy of Spain. Other ambassadors are members of the delegation of the European Union. Ms. Natasha Marzoff, Inter-American Development Bank Country Representative. Other members present from the IDB delegation in Jamaica. Mr. Lascelles Brown, Regional Director of the Southeast Regional Health Authority. Other members of the board and management of the Southeast Regional Health Authority. Mr. Abdon Campbell, Parish Manager for St. Catherine Health Department. Dr. Prosper Chen, Medical Officer of Health, St. Catherine Health Department. Other representatives present from the St. Catherine Health Department, particular team members assigned to the Greater Portmore Health Center. I'm also seeing Ms. Fabia Lam, Regional Director for the Northeast Regional Health Authority. Other representatives present from the Southern and Western Regional Health Authorities. Representatives present from the Ministry of Finance, Ministry of Agriculture and Fisheries, St. Catherine Chamber of Commerce, National Health Fund, Social Development Commission, Jamaica Constabulary Force, Jamaica Fire Brigade, National Environment and Planning Agency, National Works Agency, the Planning Institute of Jamaica, and other specially invited public bodies. Mr. Juni Wang, General Manager of the China Civil Engineering Construction Corporation, and other members of his team present today. My valued team members of the Health System Strengthening Program, members of the media, other specially invited guests. Good morning. It is my pleasure and honor to be with you this morning as we mark yet another critical milestone in the Health System Strengthening Program's mission to enhance Jamaica public health care. This groundbreaking ceremony for the expansion of the Greater Portmore Health Center comes at a time when we have been seeing an increase in the number of persons using the facility annually, and there is a significant need for an expansion in the physical space as well as a range of services to better meet the needs of the residents. This new state-of-the-art building that will be added to the Greater Portmore will span over 1,259 square meters and provide an array of essential services. But these services are not only for patients, but also staff utilizing this facility. Some of these services for this new building would include, but not limited to, laboratory services, isolation rooms, procedure, treatment, and examination rooms, and diagnostic services such as X-ray and dental imaging equipment. I must state, based on our stakeholders consultation, one of our greatest requests from the stakeholders, from community, is that Portmore does not have a laboratory services offered at this facility. So in our design, we ensure that we are actually including this. I must also state that as of yesterday, we completed the installation of our dental X-ray at this facility. And this is actually financed by the European Union, or one of our major financial partners. For our healthcare workers of this facility, we're not leaving you out. We will provide additional green spaces for this facility, modern lunchrooms, and also lounge areas, so we can satisfy your comfort levels at this era. The total investment for this project, inclusive of construction, equipment, and furnishing, is approximately $660 million. This is being funded primarily through the European Union's investment into the Health System Strengthening Program, which covers construction and dental imaging equipment. Additional support is also being provided by the government of Jamaica for the procurement of additional equipment and furniture. The main contractor is China Civil Engineering Construction Corporation, and the construction phase of this project is scheduled to be completed within 16 months. We'll also spend another 8 to 12 months to fully equip, furnish, and operationalize this facility. The oversight of this project will be done through our project management team to ensure that the facility is built to the required specifications. Our social specialists, environmental specialists, and monitoring and evaluation specialists will also be keeping an eye on this development to ensure that international guidelines regarding environmental standards, accessibility, social impact, gender relations, and community engagement are strictly adhered to. As part of these efforts, we'll be having a stakeholders engagement session immediately after the signing ceremony, where persons can receive additional information about this project, ask questions, receive answers, and how this project will benefit or affect them. Once this project is completed, this expanded health center will serve as a vital resource for this Sun City, Portmore. It will not only enhance healthcare delivery, but also contribute to local economic growth by creating jobs, both during and after construction. I must add to this groundbreaking ceremony that it is the culminating of a series of similar events in St. Catherine. We broke ground earlier this year for the construction of Spanish Town Hospital, followed by Old Harbor Health Center. 2 weeks ago, we actually broke ground for St. Jago Park Health Center. Together, these 4 projects, with additional investments in electronic health records, managed network services, training of staff, and improved information systems, represent a significant investment in healthcare infrastructure for the parish of St. Catherine. This, ladies and gentlemen, is the purpose of the Health System Strengthening Program, to not only imagine a better future for healthcare, but to bring that future into the present through targeted improvements in the areas where they are needed most. Since we have launched the Health System Strengthening Program, it has taken a holistic approach to improving the management and delivery of healthcare services, particularly in the prevention of non-communicable diseases and the quality management of patients who live with these non-communicable diseases. Our focus for non-communicable diseases is primarily hypertension and diabetes. Our achievements so far would not have been possible without the invaluable supports from our partners, particularly our Honorable Minister of Health, our parent ministry, Ministry of Health and Wellness, the Inter-American Development Bank, the European Union, the Government of Jamaica, the Southeast Regional Health Authority, the National Health Fund, our statutory bodies, our staff within the Project Execution Unit. You have been with us at every step of the way. And last but not least, the team members in this facility, the residents in the communities in and around this health center, and patients and relatives who use these facilities. You are our partner in ensuring that these changes are long-lasting and will continue to benefit for generations to come. We thank you for your patience so far, and we look forward to the continuing work with you to transform healthcare for a better future. Thank you, and please enjoy the rest of the proceedings.
Thank you very much, Mr. Clark. I must stress that the services that are to come are going to be very vital in reducing the burden on several other health facilities, namely Spanish Town Hospital, and we have the staff that is capable and ready, and we're excited for these new services. So thank you very much again, Mr. Clark, and we look forward to hearing more about what is to come. At this point, we're going to do something a little bit different. I'm going to ask everyone to stand stretch up, and then have back a seat. Let's stand. All right. I know you've been seated for a little while. Yes, let's get those legs and that blood pumping again. All right. A nice good stretch on the count of 3. 1, 2, 3. Ah, yeah, on that toes, wonderful. Have back a seat now, everyone. You did good. All right. Age is just a number, guys. Don't worry. All right. So next up, I want to introduce or invite Miss Natasha Marzolf, the Inter-American Development Bank country representative to Jamaica, to give her remarks on behalf of the IDB. Please welcome her.
Dr. the Honorable Christopher Tufton, Minister of Health and Wellness, Fitz Jackson, Member of Parliament, St. Catherine Southern, Her Excellency Dr. Eja Ascola, European Union Ambassador to Jamaica, Mr. Orrit Clark, Program Manager, Health System Strengthening Program, ambassadors, partners, distinguished guests, members of the Portmore community, good morning. I am delighted to be representing the Inter-American Development Bank at this very important contract signing and groundbreaking for the expansion of the Greater Portmore Comprehensive Health Center. This is the third groundbreaking in St. Catherine that we have participated in, and the last one of this year. It is fitting that it is here in Portmore, which I am told is one of Jamaica's growing municipalities. And indeed, Portmore is growing rapidly in commercial spaces, investments, real estate, and in its economy. It is only natural that health centers and other social services expand in parallel. From the Inter-American Development Bank's perspective, economic development is not sustainable if there is low access to high-quality social services. If Jamaicans do not receive health and other social services that will ensure public well-being, they will not experience the full impacts of economic growth. We share this perspective with the government of Jamaica, and we are very happy to collaborate through the Health Systems Strengthening Program, which aims to improve the health of all Jamaicans here. So this partnership, they have several initiatives geared towards strengthening healthcare, where we have financed over $50 million and European Union over 10 million euros in upgrading and rehabilitating 10 health centers, but also financing major hospital infrastructures such as the new Spanish Town Hospital. This work is very necessary, not only to accompany the expansion of Jamaica, cities and towns, but also to help address the key health challenges that are faced in the island. According to the Pan American Health Organization, in 2019, 24% of men and 19% of women in Jamaica suffer from elevated blood diseases. It is reported that 1 in 3 Jamaicans have hypertension. 1 in 8 are living with diabetes. 4 out of 10 Jamaicans are expected to suffer from a mental illness over the course of their lifetime. We know that non-communicable diseases are of particular concern here in Jamaica. There are consistent recommendations and interventions promoted to encourage the public to become more aware and make the necessary lifestyle changes that can decrease the occurrence of these diseases and illnesses. But to accompany this, we must also have the right infrastructure in place to help Jamaicans manage their health, receive medical assistance, and lead healthy and productive lives. This is why expansions such as this health center in Greater Portmore is just so important. With modern facilities, medical personnel can provide the preventive and curative care needed to combat illnesses and save lives. And we expect that the impact of the Greater Portmore Comprehensive Health Center will be great, inclusive, and very important, particularly for women and children. With this new expanded and modern facility, the community here will receive more health services in one location, leading to greater synergies between health professionals and improved care. This health center will also increase access to health services, which is as critical and important as expanding the services that are available. More individuals will be able to access health care in their own community rather than traveling far to another location. By improving this facility, we will build health systems in St. Catherine and strengthen public health infrastructure in the parish. These outcomes, we believe, will have tremendous positive impacts for St. Catherine and Jamaica overall. In conclusion, I would like to highlight this partnership could not be accomplished without the vision of health leaders and the leadership of the Ministry of Health and Wellness. The IDB has built a very strong relationship with Jamaica and its government for many years. And through projects like this one, we are truly able to collaborate and work towards improving the health of Jamaicans, which is one of our main priorities. I would therefore like to thank Minister Tufton, the Ministry, the project execution team, and the European Union for working together to make this project possible. We look forward to continuing collaborating and increasing our support to the development of communities such as Portmore as we build not only a stronger but healthier Jamaica. Thank you very much.
Thank you, Ms. Marzolf. I must mention the HSSP is administered through the IDB, and they've been working very close with each other since the project inception in 2018. HSSP is set to invest approximately 148 million US into revamping and strengthening our health sector, 50 million of which comes from the initial loan agreement with the IDB, 87 million from the Jamaican government, and 10 million euro from investment grant funding by the European Union. This is something that is crucial, and as some people say, it takes money to cure, and we definitely need some investments in order to make things change. At this point, I'm going to introduce or invite Her Excellency Dr. Urjo Ascolo, the European Union Ambassador to Jamaica, to give her remarks on behalf of the EU.
Thank you very much, and good morning to everybody. Dr. the Honorable Minister Tufton, Christopher Tufton, Minister of Health and Wellness. Minister, this is the third time we do this within 3 months. So I can confidently report back to Brussels that things are progressing well in Jamaica. Thank you for that. Excellencies, ambassadors of European Union member states, I'm very happy to see so many of you here. We have the ambassador of Belgium, we have the ambassador of France, and the ambassador designate of Spain. Thank you for coming. Just today, a note on the European Union and how we function, because we are a supranational organization that consists of 27 member states, and the 3 of them are now with us today. And how we work is that member states, they have kept some of the powers for themselves. They have conferred some of the powers that are typical to nation states to the European Union, to us as institutions. And in some areas, we have shared the powers. And development cooperation is one of these areas of shared powers. So it means that the member states, they have their own development programs, and the European Union institutions have their own development programs that are funded from the European Union's budget. And our budget comes from somewhere, and it comes from the taxpayers of the European Union member states, primarily. So this is why I want to recognize specifically the participation of the EU member states here, and recognize the contribution that they make to the European Union budget. Let me go on with the protocols, even if they have already been observed. I want to recognize His Worship the Mayor, Leon Thomas, Mayor of Portmore, Honourable Fitz Jackson, Member of the Parliament, Honourable Robert Miller, Member of the Parliament, Natasha Marzol, the head of Inter-American Development Bank in Jamaica, country representative, representatives of Minister of Health and Wellness, residents of Portmore, members of the media, ladies and gentlemen. It's truly an honor and a pleasure to be here in Portmore. It's my first time in this city as the new ambassador of the European Union to Jamaica. Today, we are not just cutting ribbons and talking about buildings and facilities. We are taking another step toward a healthier and stronger future for Jamaican people. Health is at the heart of the European Union, of what the European Union stands for. Across Europe, our member states have built systems that ensure healthcare isn't a privilege, it's a right. I'm happy to see that Jamaica is on a similar path and approach to make healthcare a right and reality to all. The health system's strengthening program isn't just about facilities, it is about people. People like you, people like me. It's about giving healthcare workers the tools to do their jobs and the resources to save lives and give people the treatment that they need. And this is what this event is all about. It's about partnership, a true partnership. When the European Union came together with the government of Jamaica and the Inter-American Development Bank, we joined our forces and we joined our resources to build something concrete for the benefit of the Jamaican people. And this Portmore Health Centre will be one of these joint endeavours. The European Union's contribution has already been mentioned many times, and this whole program is part of a broader package of the European Union's support to Jamaican health systems, We have already worked to improve maternal and newborn care here in Jamaica. And during the COVID-19 pandemic, we provided vaccines and life-saving equipment to some health centers. Progress isn't about big speeches and grand gestures. Progress happens when a mother can bring her child to a clinic and leave with the hope for something better. Progress happens when a nurse or a doctor goes to work knowing they've got the tools they need to save life and to give the people the treatment they need. So today I want to thank all of you who have made it possible, Minister Tufton, our partners in the IDB, and every person who worked tirelessly to make this happen. So let's keep going, let's keep building, let's create a future where health isn't a privilege, but it is a reality and it is a right. Thank you for your attention.
Thank you so much, Ambassador Ascola. Well said. I must highlight that though the HSSP has a project unit or execution unit in New Kingston, really for HSSP to be truly effective, it has to be owned by the persons who operate in the facilities. So there's a strong call to action that the team members who are benefiting, that you truly embrace and find out what part you can play in ensuring that these changes are executed to the best so that we can fully embrace what is to come. I must use this opportunity to highlight the change management booth, which is to the back of the venue on my left, led by change management specialist Cordell Williams. I'm encouraging everyone at the end of the function, please go to the booth. There's some prizes and surprises, I'm told, so get in on it. All right. As you can see, there are a group of persons to my right and to my left, and they're here from the Portmore Missionary Dance Troupe. And yes, absolutely. And they're ready to give us a wonderful item, so please give them your undivided attention at this point. Thank you so much, dancers. I remember when I could move like that. But times have changed and I've accepted the change in my age. But such is life. Next, we're going to have Dr. Honorable Minister Tufton to come and give the keynote address. But before he comes, I want to bring your eyes to the screen for you to get context of what he's going to speak about. Okay?
Improved primary health care is coming to St. Catherine, and to aid its delivery are new and upgraded health centers at St. Jago Park, Old Harbour, and Greater Portmore. I am Chris Tufton, Minister of Health.
Everybody blame Fitz Jackson. Don't like when we come to him town, you know? All right. I feel a little taller than this podium. I don't know, it's unusual. It's a different podium. Let me begin, first of all, by welcoming all who are here, starting, of course, with persons who are not unfamiliar with this place. Chairman Dr. Kelly, thank you very much, sir, so far for the proceedings. To past, is it Bludgeon? Blidgin. I remember you told me there was a letter there that was silent. Thank you very much, representing Custos Golding. My colleague and friend, Fitz Jackson, who is Member of Parliament. Good to see you, sir. And I must say that your presentation today is very different from the Mayor of Spanish Town, who normally presents on the other side in terms of the inclusivity, and I really respect and admire that. Not that I don't respect him, I do too, but we take a lot of jabs at each other. Just to recognize my friend and colleague on my side of the aisle, MP Miller, thank you very much for your support, sir. Don't be discouraged by him saying that he schooled you and he's sticking close to you. What he doesn't realize is that sometimes you have to fly away to find greener pastures. And I believe that's exactly what you have done. So but I want to just recognize both members of Parliament. It's good that they are here, and I know that MP Terry Long would have wanted to be here, and he sends his apologies. All combined, they provide the important political representation, as well as with the municipal authority, the council here. I know the mayor isn't here, but I do note that Councillor Preddy, who is the councillor for this area. Good to see you, sir. In another life, you're a pastor, like the Kahiba, or is... You got it from Joshua. All right, good, good. Well, we celebrate Joshua yesterday for his 100th birthday, right? And I figure you'll continue that celebration. But good to have you, sir. And thanks for the support. It's important to recognize all sides of the political process, because this is truly, health is not supposed to be political. Health is really everybody's business. And I want to just say how happy I am that all are here and are participating in this. Of course, our very special guest and part of the project, the European Union, head of the European Union, Her Excellency Ascola. Did I get that right? And I really admired your presentation, at least the start of it. And it's something I want to encourage, if I may be so presumptuous, because you, in a very simple, straightforward way, provided us with critical information of how the European Union funds its projects. And I mean, I had my own ideas, of course, because I've done my reading, but I think for the benefit of all of us, it was a very important lesson, 101, about the European Union. Now, these two mics are not going to coexist up here, so maybe you need to take one of them off, someone, or adjust it. So I just want to commend you on that, and of course, thank you and the European Union, which has a number of your members here. I believe you said Spain, France, and Belgium. Excellent. Well, welcome to all three ambassadors. Really appreciate your being here. And thank you for contributing to the European Union, who is now contributing to us. That doesn't let you off the hook, though. We need to discuss a project based on the funding definition that is direct to each country. How is that? Your ambassador who represents you actually put you in a little spot there. So we're going to find a project to send to each and all of you and find a way to make it work. But thank you very much for being here. Of course, the country head of the IDB, we want to say to you, as usual, the partnership is strong. And if there's any doubt that we were just in concept stage, I think that doubt would have been erased by now. Because you're actually in sunny Portmore, breaking ground, as you were elsewhere doing the same thing. So I want to just say a big thank you to you and to the IDB, and please pass on our best wishes to the rest of your team as we continue to see through to the success of this project. Other members who are here, including my health team, I see my regional director, Brown, parish manager, Campbell, parish health officer, Dr. Gaspar Chen, right? Yes, I think so. Other members, I see another regional director who is here from faraway land in St. Anne. I'm happy to have you. And you're welcome to be wherever we are, because we cherish your contribution. Other members of the health team, and of course those from Greater Portmore here. Let me big up the local team. And I see you sitting there in the brown and the blue, and I'm sure there are others of you. Thank you very much for being here. I know it's a good day for you, and there are a lot of good things to look forward to. Members of the local project team, led by Oret Clark. Where's Oret? I saw him earlier. He's somewhere here. I want to just say thanks again. He gave the presentation. So a lot has been said, ladies and gentlemen, on what this project represents. And it's not my intention to repeat all the lovely speeches. I'd prefer to look forward and to try to articulate a little as to where do we go from here. But in a minute or two, I have to, with pride, and I do so in absolute humility, and on behalf of all the stakeholders, local, multilateral, and bilateral, who are part of this, that for the first time in the history of this country, at least since independence, public health is spending, Fitz-Jackson, I know you're looking at me at your glasses there, 10 billion Jamaican dollars to improve the health infrastructure in the parish of St. Catherine. And I challenge anybody to give me any other time in our history that is happening under one program. That's 65 million US dollars. That's not anything to sneeze off or scoff at. That's not anything to not be encouraged by, because it signals the strongest of intentions on behalf of this government to partner with the partners that we have partnered with, but more importantly, to address the shortcomings that we have seen. And all of us, even the blind, can see that there are shortcomings. There are inadequacies. There are gaps that need to be filled in the public health infrastructure in our country. And it's one thing to define the problem. It's another thing to do something about the problem. We no longer are in the concept stage. We no longer preaching or articulating a vision. And Fitz would tell you, after 8+ years, we'd be in trouble if that's all we were doing. When we're done, he's going to witness the signing of the contract. And he's going to drive past this location, my good friend, and everybody else, from today onwards to see the work in progress. So $10 billion is a big amount, it's a big spend. And by the way, that's only in one program. Because if you look to the extreme back, there are the designs of put on display there. The one that's different from the others represents the Christian Penn Health Center designs that are now complete, which will be a $250 million expenditure, which we are now finalizing to begin with. That's in the constituency of Member of Parliament Terry Long. And I want to thank the NHF team and others who have been part of that. You can give them a round of applause too, right? And I know that MP Miller is here for a reason. Apart from being a Portmore citizen and a lover of the people of Portmore, I know he wants me to say that. He also would want me to add that we are assessing the Waterford community and a piece of land that is there, trying to regularize that land to proceed with doing our own assessment for a health center at that location. So we are all inclusive, but more importantly, we're catering to a growing community, and a community, frankly speaking, that needs the support. And by extension, a parish that is growing at a very fast pace, and St. Catherine, and that requires, yes, Parish Portmore, that's a good one. That will come soon too. But a parish for the time being called St. Catherine, for the time being meaning until other things happen in Portmore, not in my job description, so I won't go too far into that, that we are trying to respond to inadequacies. And I am not, as the man on the bridge for this point in time, going to pretend that we don't have challenges that we must overcome. I am more concerned with how we overcome those challenges. And I believe that is important. Fitz made a point that I want to respond to. Fitz, that is, and you're right, you build a new facility and everybody wants to experience the added services. And so you will get a rush into that facility. I want to reassure you that we thought about that in terms of how we designed this program. Because St. Catherine has 4 locations that are now being developed, having signed contracts over the last number of months. Old Harbour, with Minister Warmington, St. Jago Park, right beside Spanish Town Hospital with MP Denise Daly, and Spanish Town Hospital with a massive expansion there for everybody, of course, and now we are in Greater Portmore. So essentially, we have assessed how the population is dispersed, where the concentrated areas are, and all of these facilities are comprehensive. So they are going to be providing the same levels of service. So we do expect that you will get people coming from all over Portmore to this location. In some instances, yes, until we sort things out. But we don't expect Old Harbour to come over into Portmore because they will have their facilities, similarly to St. Jago. And indeed, I go further by saying the vision expands globally, meaning nationally. Because in another few months, and I know the IDB is aware of this, we are hoping with our collaborators to announce major expansions in the parish of St. Anne, both health center and hospital, major expansion in the parish of Clarendon, both health center and hospital, and I don't need to tell you what is going on at Cornwall with Western Child and Cornwall Regional. In other words, in summary, the upgrading of our health infrastructure is not being done in any other way except that the people who live in the communities need the added and improved services. And if we were doing it any other way, Fitz wouldn't get the first one. If I am to be very politically correct, we'd probably find somewhere else and put it. And I want you to tell me that I'm saying the right thing. You'll tell me after, I'm sure. I want you to say that in the parliament, that you get the first one, right? Not Miller or Terry Long. But that's based on the assessment of where the people are and why we need to do what we're going to do. So that's the first point I want to raise. $10 billion, and we must feel good about that. And those who are non-believers, I hope, will believe beyond today. But beyond that, the next steps, completing the project. Because we've come a long road. I've been minister now, February coming, 9 years, probably the longest serving health minister. I was told by a professor abroad at a seminar I was at, that after I told him 8 years, he said, "You're the longest serving health minister in the world." I don't know of any other health minister who lasts that long, especially with COVID. I'm going on to 9 come February. And yes, I have the gray hairs to show for it, because it's not an easy road. But we started on this journey 6 months after I became minister. I visited the IDB in Washington. We made the pitch. The project was conceptualized, developed. And fast forward to today, it has taken a very long time. And in our exit interview, when this project would have been complete, it is something we're going to have to assess. It takes too long to respond to the needs of people in communities around project development and implementation. But that's not for today. The point is we are where we are, and this is a good thing. But we have not completed the journey until we complete the project. And I don't know where I'll be in another year and a half. We say 16 months to complete this, or maybe more. But I'm glad we're starting. And what we're going to appeal to all concerned, including the community members, including the leaders in the community, like Fitz and Robert, that we must ensure that we give all the critical support to ensure that the project is successful. Because ultimately, it is our project. It is being spent for the community, for the use of the community. And we're going to be working very assiduously to ensure that all hands will be on deck to do that. You will see me coming on, visiting, coming with the project manager, because I've kind of transformed from being the policymaker now to overlooking what is happening on the project, checking the timelines to make sure we're meeting our targets and so on. And we are going to hold people to account, whomever you are, whatever role you have to play. So you'll see a lot of activity going on, and we ask for your support in that. The second challenge that we face is staffing, because we already have a challenge with staffing our facilities because of the mobility of healthcare workers. And one of the things that we're going to have to do, and we have started doing, is assessing what our human resource needs are and starting to find ways, in the first instance, to train and to place more locals in positions that will be needed to accompany the enhanced infrastructure. And there are many that will be needed. And then if that fails, we're going to have to recruit externally. Because one of the worst things you want is to build a new facility and have nobody to man the facility. Build a new facility and have nobody to operate the equipment, the machinery. Build a new facility and don't have the specialized personnel to provide the services that the Jamaican people, the people in the community requires. So you would have heard that we have launched the Barwin Scholarship, $500 million a year for 5 years. That's all geared towards expanding our human resources. Next month, we're having one of the largest career expos at the University of the West Indies. organized internally, which will see on display up to 25 areas, careers in public health. It's not just about the doctor and the nurse. It's about the biotech engineer. It's about the pharmacist. It's about a number of skill sets that are critical to making the system work. And we're going to be putting those on display. We're going to bring in the sixth formers. We're going to invite the public to come, see what is on display, and to the extent that they qualify or can become qualified to train in these areas, we will support them where they qualify with scholarships. That means they are bonded back into the system, by the way, between 3 and 5 years after you have studied. But I think it's a good deal. So I want to throw out something here in Portmore today. I want to say to those who are listening, here or elsewhere, look for a career in public health or in health, generally. The world is short by, I am told, 15 to 20 million healthcare workers. That's why labor healthcare workers are so mobile. That's why they are being recruited. Jamaica has a good reputation, and invariably, others offer far more resources than we can in the developed world, and because of proximity, we tend to lose most of them. It's not a simple challenge that we face going forward. And so I'm sounding that alarm that we want more Jamaicans to be trained in the area. And just take that up for me now. Huh? Take that up there. We want more Jamaicans to be trained in the area. Thanks. And to the extent that we can't identify more Jamaicans, we're going to have to do what the Americans do, or the Canadians do, or others do. Recruit. Last week, the CMO, Chief Medical Officer, was in the Philippines, and the Permanent Secretary, where they signed an MOU, or I signed an MOU, with the Minister for collaboration around healthcare training and recruitment where necessary. There are 3 elements of that MOU which is now signed. One is to look at gaps within our HR process. Where are there major gaps that we can't fill locally? And explore the opportunities for international or bilateral arrangements for recruitment. The second is in training and the possibility of exchanging faculty to improve our capacity to train more, because that's a big issue. We lack faculty for training more. And the third is in the area of maintenance of our plant that we're building out. Because one of the other bottlenecks that we face is how do we replace, how do we maintain and ensure we get full maximum value from the plant and the equipment that we will put into these facilities over time. And we have significant gaps. Too often, our system breaks down, and because we have no one to repair or someone has to fly in from overseas, it stays down and the patients suffer in the process. So you will see and hear more about recruitment and training and retraining as the next period of build-out takes place so that we can adequately equip. Play your part if you're interested and get involved in the process. The final point I want to raise around the next phase is the issue of change management. And I've spoken about this a couple of times on platforms similar to this one, because what we're actually creating is a very different ecosystem from what exists currently. We are modernizing or upgrading our health infrastructure in a potentially game-changing way. Game-changing, not just that we will have new equipment, but game-changing for the patients and the staff who use the facilities. The tangible manifestations of these signings is not to celebrate the signing, as was said earlier. It is what it means for the people that we serve and for those who provide the service. And so doctors and nurses and support staff have to be more comfortable in the environment. Every design is built to ensure that the staff is more comfortable. Whether it is a lunchroom, whether it's somewhere to place their personal belongings, whether it's a more comfortable chair, a computer system to pull up data so they don't have to wait on a file to be transported physically, All of this is intended to make the staff more comfortable. But we expect that out of that comfort will come greater levels of productivity, output, that more patients would be seen in a shorter space of time, that we will have the history of the patient. So assessing their problems, knowing what they're allergic to, knowing how they can be treated, will be done in a shorter space of time. And that means a change in the mindset of how we go about doing our work. Now, the project has in it an inbuilt change management function. And we have an officer who is responsible for that. I met with them yesterday, Orette and I. We had a long discussion with her. We looked at the plans and we dissected elements of the plan. But you know, one of the greatest way, more significant way to get change is to change from within and to find agents of change within the organization. And so I want to use this platform, given that we are now completing the fourth of 4 signings representing this $10 billion worth of investment, to say to the people of St. Catherine and the healthcare workers, we need agents of change in how we go about doing what we do and how we treat with and serve the people who are in our communities. We want the catalysts. We want to identify those individuals who are embracing with energy and enthusiasm and passion the need to take what we have and what we're developing and make the healthcare provision a better prospect for those in the communities who need it. Some of this is very basic. So the change agent don't have to be the CEO or the chief nurse or the chief doctor. It could be the customer service rep. It could be the person inputting the data when they register. It could be the person cleaning the floor. But they're going about the business of preserving and offering a better service than was ever offered before, because the investments reflect a new way of thinking and doing things. And so we are recruiting change agents as part of the way forward. And there's a change desk at the back there, change management booth. And those who may be interested to learn more about what this means, please go and make your voices heard, give your names, and we will find a way to put you into a stream that provides some of the support for what we're trying to do here. So ladies and gentlemen, this is again an important part of a holistic approach to public health and the change. Jamaica needs it because lifestyle practices, as was shown on the video earlier, is what is challenging us significantly. The reason why primary care and health centers in our communities are so important is that we have to take the message around lifestyle to the people. We can't wait for the people to come to us because more often than not, the horse gone through the gate. It's too late. And so part of establishing a facility here, a comprehensive facility, is not only that people access it easier, but that our people here can go out in the communities and visit, as they do now, the people in their homes and provide the right message. We are a developing country, but healthcare can be as developed as any other developed country elsewhere. We now have the basis on which we can build. Everything now is up to us to make it work. And I encourage all of us to play our part in making that happen. Thank you very much.
And to aid its delivery are new and upgraded health centers at St. Jago Park, Old Harbour, and Greater Portmore. I am Chris Tufton, Minister of Health and Wellness. These 3 facilities are beneficiaries of the Health System Strengthening Program, which is being implemented by the Government of Jamaica with the support of the European Union. The St. Jago Park Health Center is being prioritized for expansion to increase the service offerings and reduce wait times while also decreasing the demand at the neighboring Spanish Town Hospital. The new San Diego Health Center will be upgraded to a comprehensive facility spanning 634 square meters. It will be constructed with direct connections to the existing structures, including the conference room building. The Old Harbor Health Center will span 1,994 square meters and allow for expanded services for the community, including an immediate treatment and emergency operations center, asthma bay, oral rehydration solution room, pharmacy, lab, and radiology. Also forming a part of the services will be physiotherapy, ophthalmology and audiometry screening, mental health, dentistry, x-ray, and phlebotomy. A health promotion and prevention unit together with nutrition and a contact investigator, as well as maternal and child health, will also feature in the offerings. The Greater Portmore facility will also be upgraded to a comprehensive facility. Boasting a total area of 1,200 plus square meters, the new building will enable the offer of a suite of services from oral rehydration to lab services, an isolation room, x-ray room, treatment and procedure rooms, asthma bay, diabetic retinopathy, physiotherapy, community health assessment rooms, and examination and exercise rooms. The Health System Strengthening Program, supporting primary healthcare reform.
One, two. Thank you very much, Minister Tufton, for both your words in person and on screen as well. Couple things that stood out to me is health is never political. It's everyone's business. And everyone is needed, not just the doctors, not just the nurses, but everyone is needed because everyone has a role to play. And we all need to be agents of change. Even if you don't sign up at the booth today, which we encourage you strongly to sign up at the booth, but we all need to be agents of change. At this time, I'm going to invite the following persons to proceed to my left, which will be your right, to the contract table in this particular order so that we can facilitate the official signing of the contract. Minister Tufton. Minister J. Wang, CEO of China Civil Engineering. Mr. Orette Clark, HSSP Program Manager. Her Excellency Dr. Urjo Ascola, European Union Ambassador to Jamaica. Mr. Abdon Campbell, Parish Manager of St. Catherine Health Services. Ms. Natasha Marzolf, IDB representative, and MP Fitz Jackson. So I'm asking all parties to make their way to the table at this time so that we can have the official signing of the contract. And also RD Mr. Lascelles Brown to the left as well, please. Thank you so much, delegation. At this time, I'm going to advise you to kindly collect your hats. And I'm told everything's run by the front. So I'm going to ask the delegation, everyone who's leaving the table, to head to the front for your relevant tools. I'm asking the audience to stay seated because we have something special in place for you while they're doing their additional photo opportunities. We have something special in place for you. All right. So, while the groundbreaking photo opportunities are taking place, we are going to be having a stakeholder engagement session, which will begin right now. This session is an important part of the day's proceedings because it gives you, the stakeholders, an opportunity to understand the social and environmental impact of this program and the steps that are being taken to safeguard you. So please, this is the time to ask your questions. No question is off limit. If it involves you as a stakeholder, ask the question and get your clarity. This session will be led by Grace and Scarlett Duncan, social specialists, and Cleve Henry, environmental specialists, both from the HSSP. After which, like I said, there will be a question and answer segment, after which their lunch will be served, and I will advise you at what point that is. All right, so stakeholders, get ready, shake it off. The fun part is coming now. Ms. Duncan?
Pleasant afternoon, ladies and gentlemen. It has been a very long morning, so we know that we will be as brief as possible. But we thought that it is fitting to give you the opportunity to ask us how this will be done. I must recognize Mr. Julal. I know we have Ms. Barrow and Aishiwawa Hope from SDC and some of our other representatives and staff members. The conversation has to continue in terms of how will this be done, because we are operating in an area that is already occupied. We have staff and we have residents. So therefore, and I must acknowledge also Mrs. Shereen Walker-Francis from SDC. The SDC has been providing tremendous support to us to ensure that the community is fully aware. Councillor, happy to have you. So, that being said, we are not going to be long. You would have received a flyer, and at the back of that we have some environmental social performance standards. These are the standards that tell you exactly how we must operate. We have to ensure that we do proper assessment and management of the environmental and social risk. We have to focus on the labor and working conditions, resource efficiency and pollution prevention, community health, safety and security, land acquisition, not in this particular case, but we have vendors that are involved and we have to address them accordingly. We have the trans-fine procedures just in case there are any artifacts discovered on the site.
we have to focus on the gender-sensitive issues, and stakeholder engagement is important. What we want from you today is for you to come to the back of the tent and ask us questions. Now, to incentivize you, we have some giveaways that will just, help to engage you in the process. And that is really what we want from you today. The conversation continues. We know for a fact that everything cannot be said today. However, what we want you to understand is that there are environmental and social safeguards in place to protect the rights and liberties of persons who are in the existing environment. The development must be sustainable, it must be harmonious, and we want to ensure that if you have a challenge, you can reach out to us. We will be here. We'll be here to support you during this particular development, and we want you to understand the standards that are here to govern the operations. So that being said, I will now invite my colleague, Mr. Henry, just to say a few words to you as it pertains to the environmental standards, and then after that we will have lunch. If you have any questions, we will be here to take them. You have heard a lot, so it's time for you to give us your feedback. Thank you.
There's no presentation. All right. Good afternoon, everyone. Okay, my name is Cleve Henry. I'm the Environmental Health and Safety Specialist. And I know that with these kind of projects into the community, there would be concerns about the environment. We are here to tell you that from the inception of this project, we have done our due diligence, like the environmental impact assessment, where we look at all the factors, risk factors, environmental risk assessment that would affect the community due to this kind of constructions. Okay, so that has been done. We also be guided by the IDB requirements as well, the environment social policy frameworks, which is all about the preservation of life and protection of the environment and property. It's also dovetailed into the environmental, social, and policy program as well, where we ensure that the risk assessment associated with all the contractors, no contractors can ever move forward without completing the environmental, social policy program. And this is all about how they would conduct all the safety code of conduct, everything that associated with the construction, the demolition, how the community would be affected from demolition, from excavation, vibration, the biological hazards, the traffic management. And we are here to tell you that we have put everything in place to safeguard members of the community and all its stakeholders. So we are here to answer any question that you may have.
Right. So that's it. We told you we would be brief. If you have any questions, you can pose them now based on what you would have seen and heard since morning, and we will be right here to facilitate further conversations. All right? Yes. Hold on.
Much has been said about the Sunshine City since morning. Will consideration be given to the use of solar energy in the construction of the building when it is finished?
Okay. Just to say that right here, there is the project will consider energy and water efficiency as well as natural disaster resiliency. As it pertains to solar energy for this facility, I wouldn't be able to speak to that immediately, but as soon as our technical team is back from the tour, we will be able to provide that response. Okay? Thanks for that question.
Good afternoon. Sir, you said the thought about all the possible environmental issues that we may have. But this one is inevitable, and how will you treat that one? Dust nuisance.
Okay, so apart from implementing all the dust monitoring system, the first thing that we would implement on site, which is a low-hanging fruit, during the excavation and demolition, we should have dust nuisance. We would have a water truck in place, and that is the easiest thing for us to have. The water sprinkler truck would go around and sprinkle, keep the dust down.
Next question. We currently have a major sewage issue. How will you guys be adding to that, to the current sewer line? Will we be fixing what we have here currently? It is awful right now. So,
yes, we understand that. We are presently engaged in the NWC for possibly tapping into their system. Or if that is not adequate, then we'll have to implement our own system.
Good day, sir. I would like to add to that question.
Please take the mic. We cannot hear. Yes, sir.
Yes, I would like to add to that last question on the drainage. We have seen the rainfall, what it has done to this area in the past couple of weeks. Is there any plan to deal with that drainage problem that we would have?
Yes, sir. This was properly assessed and is a part of the stormwater that will be improved as well.
Stormwater drainage system. Yeah.
Good afternoon. Jennifer Lee, All Hellshire Leadership Council, Hellshire. Question. One of the suggestions I am making in relation to the question just went by a while ago, you could erect a barrier, given that you're in a developed area, very developed area, a barrier around the perimeter of the project so that some of the dust is retained inside. Question I want to ask though, how will you deal with the current patients that you have, the patient load? I know doctor would constantly be having these persons here. Where would they be going? Will it be open? How will you facilitate the patients coming in, the regular patients coming in?
Okay, thank you for those questions and also the recommendation. Now, after today, there will be some other formalities to be done with the contractor, but very soon the contractor will be hoarding the site. And what that means is that that area will not be accessible to other persons. Along with the other mitigation strategies that Mr. Henry spoke to, we will have to ensure that they adhere to the standards as it pertains to the resource efficiency and pollution prevention. If it is that the project is not compliant, the project can be red flag, because IDB is very much for these practices, and also there are local laws that speak to the protection of the environment, and we are mindful that we are operating in a space that is occupied, and the Ministry of Health and Wellness has that mandate to promote the healthy environment. As it pertains to the patients, they will not be impacted because the access to the facility will remain unchanged. It is only that section that we will be operating in that will be cordoned off, so to speak. The contractor will take over that area. All right?
Hello? Can you hear me? Okay.
Yes.
Question.
Wait, we didn't issue the rule first that the MC is not permitted to question us. But I want you to understand the importance of his question, because even though he's here supporting the process, he's also
an occupant or he works in this environment, and therefore his question is very relevant. Thank you very much, sir.
I can ask a question?
Yes.
Wonderful. Good. Just making sure. All right. So we've mentioned that Portmore is expanding. And one of the things that come with that expansion is everyone is driving. So we already have a parking issue as it relates to staff who currently drives, not adequate parking. And along with that, the terrain for which the parking is not necessarily suitable. So given the new construction, what steps are we taking to, one, provide adequate parking for the staff and patients who may drive, and two, to ensure that the terrain for that parking will not be affected by natural disaster, so to speak? Because we have lots of rain in Portmore when it's time, and the parking is in dismay after such rain.
Okay, very good question. So our traffic management plan approved by NWA take all these traffic and parking arrangement into consideration. So it has already been addressed. I may not be able to tell you point for point now, but as part of the risk assessment and as even to get the traffic management plan being approved by NWA, these issues were also addressed.
Okay. Any other questions? I know that it is hot, and we don't want to detain you any further. But so therefore we say to you, as soon as you collect your lunch, then you can join us at the back, and also we can give you further explanation as to what the facility will look like, and you can ask further questions and get your incentives. Thank you very much, ladies and gentlemen. You have been a very, very, great audience, and we look forward to working with you as we seek to develop Greater Portmore. Thank you very much, Councillor, for staying with us, and it has been a real pleasure. We will have further conversations, all right? Thank you.
Thank you very much, Mrs. Duncan and Mr. Henry. Thank you all for who came and stayed. I want to use this opportunity to also thank the clinic attendants who played both sweat and labor into ensuring that the grounds were actually taken care of for this event. At this time, I'm going to encourage everyone to collect their refreshments, but also I'm going to encourage everyone to visit the change table at the back and ensure to look at the plans. I know some of us don't like to ask questions in public, so feel free to ask your questions on a smaller scale then. At this point, we are officially going to end today's proceedings. Thank you very much, everyone, and have a wonderful day.